Today's guest is a Saskatchewan girl through and through. Born and raised here, she completed medical school in 1983 with distinction and is a family physician and child abuse consultant in Regina. Her training and experience in the field of child abuse spans over 30 years, and she has been instrumental in creating the first and only Child Maltreatment Team in Saskatchewan. Although this work is very difficult, even I can say, after having just met her, that she continues day in and day out with a very positive attitude. Dr. Sharon Leibel, welcome.
Thank you.
Thank you for being with me here today. I can see you're at the office.
Yeah, we have not gone electronic. And I would be less instrumental than more good at taking orders from the people who were good at organizing and setting things up. What I have is longevity, not competence. Yeah.
Excellent. Well, Sharon, tell us a little bit about your work. It sounds like a very interesting body of work, and I would have to say emotionally exhausting body of work. So just tell us a little bit about it.
Well, as a family physician, we cover the gamut, right? Birth to death and beyond for the survivors. With the Child and Family Medical Services Team, which is, I guess, our technical name, CFMS, we are the medical arm of a multidisciplinary team. So police, city, RCMP, social services, and the medical team all work together when there is a suspected neglect, abuse, maltreatment of some sort case. We would be the ones doing the physical exam, handling the basic medical needs, and the difference for us from just being the normal physician seeing the child would be being able to give an opinion as to causation of injuries, or being able to give an opinion as to whether history matches findings.
Right, exactly. There's sort of that first instance versus there's been a history of instances. So this is probably a question I don't want the answer to, but I'm still going to ask it. What is the prevalence of child abuse in our province?
Far lower than reported. We are seeing the tip of an iceberg, right? We are seeing the children who a neighbor or a family member or the school, often the school or the daycare, have concerns.
Okay.
What we are lacking in the last 3 months is that oversight, those eyes on the children. No school, no daycare, relatives not mingling. So we're actually terrified about what has been going on over the last 3 months.
Yeah.
I know from some of the news as well as child abuse forums that the poor police who monitor the internet have seen, because they're monitoring chat rooms, etc., they have seen pedophiles exulting with glee that
because there's been so much unmonitored. Yeah. One of my past guests was Joanne Dussel from PAVS, and so as an association, they support domestic violence homes and things like that throughout the province. And Joanne talked about the prevalence in our interview, and like I was shocked. I was actually speechless at one point. Joanne kind of had to keep talking because I was like, "What?" And that's a sentiment that I have expressed many times throughout this pandemic. Is that's what scares me, is these families who don't have the supports that they need right now. Kids don't have an outlet. You don't have somewhere to go and say, I need help. They're not allowed to leave the house. Now, it's gotten better in the last few weeks, but still not enough so. They're not back in a classroom or a daycare.
One of my sisters is an elementary school teacher, and she has been heartbroken because she said for a percentage of our children, school is the safe place. There are more than one organization, from Mobile Crisis Services to Ministry of Social Services to the Children's Advocate, who have expressed a lot of concerns about this, and the catch-up work we're going to have to do. As far as the incidence goes, much like when we're talking about the incidence of domestic violence, there's such a range. Children who are emotionally neglected is child abuse. Children who are emotionally denigrated, just like a spouse who is emotionally denigrated, is child abuse. Children in whom someone is failing to provide the necessities of life. And that could be as simple as 3 meals a day, or children whose asthma is poorly controlled because the inhalers are not being purchased. Now, there are a lot of families absolutely trying to do their absolute best and struggling. There are families who get reported because their kids don't look as well dressed. Their kids don't. And these are loving families who are doing a fabulous job of giving safety and security to their children. So the nice part of my job is when we can say, this is a good family, this kid is fine. They may look a little different. Their clothes may be secondhand, not new. And guess what? One bruise on a child of active ambulatory age is pretty normal.
Exactly. One, how about like 25 on mine?
You would not believe how many kids I have seen because someone, God bless them, was concerned with a low knowledge base.
See, I would worry more if my kids didn't have bruises, because they're constantly, my kids are preteens, they're constantly banged up. And when they're not, it means they're sitting on the couch watching TV.
Exactly. So I have seen a whole lot of kids who have fewer bruises than I do, and that's simply an uncoordinated adult, let alone a moving 5-year-old.
Exactly.
But another patient of mine who's a teacher and a very conscientious and concerned person said what the last 3 months has done is widened the inequity gap between the social classes and between the kids. We have set children who were struggling way back. And I don't know what the educational system has in mind. Like if we could provide summer school without singling out children, if we could make it a school camp thing, and look, you don't have to find daycare. We will teach your kids and entertain them. That would be fabulous.
Exactly.
And a lot of the schools did their best. They set up, programs. You could get a loaner laptop so that your child could do their classes and stuff, but we knew that there would be problems with that. There were more computers offered than were taken up, despite there being a lot of kids who really could use it. There were computers that were loaned out, and yet there was no contact. The work was not done and nothing happened. So we've got kids who need outside resources in place.
Yeah, and that's the unfortunate thing about everything that has happened over the last few months is those who needed help most couldn't get it. Those who maybe wanted help still had the ability in one way, shape, or form to likely get it. And so if you were struggling, you'd pick up the phone, you'd call your, doctor, you'd call someone. And I think I agree with you that inequity gap has gotten much larger. So what is it, Sharon, about this type of work that called you? I can't imagine in 1983 when you graduated, you were like, woohoo, I'm going to help kids that are being abused. Or maybe it was. How did this happen?
No, it's like most things in life. You fall into it. I actually graduated and worked 3 years in Merge before I went into family practice. Went into family practice at the same time I got married. Somebody came up to me and said, I've been working in the initial old team we had, which was a pediatrician, a hospital pediatric social worker, and a family physician. She said, I've been doing it for 2 years and I feel that I need a break and it's your turn. and I'm Catholic, and we're really good at like, oh, well, then it must be my turn. Um,
Exactly.
we can guilt ourselves into anything. So I did that for 2 years, where just the pediatrician and I and the social worker would see children, and a small number of children were being identified.
Yeah.
So the numbers were way down. And sort of the second year I was doing that, I was pregnant with my first child, and apparently a raging ball of psychotic hormones. Um, my husband, the police officer, said, "Yeah, you aren't actually allowed to kill or castrate anyone, so maybe you should take a break." Um, Geez, was I allowed to say that on air? Anyway, so I took, I told them I needed to take a break, and then I had my children 16 months apart, so I knocked out two, at which point a wonderful family physician, emerged physician from who was moving here from Vancouver came and said, "Look, in Vancouver, we have this multidisciplinary team where everything is linked together." And it was actually Christine Vuxic who sort of just went out and found the bodies and said, "Look, we have to educate ourselves, and we'll take turns on call instead of one person at a time.
Mhm.
And we will form these links with the police." So us reaching out to the police actually helped them gradually move towards the Regina Children's Justice Center,
Mhm.
which is one of the first team
Ah.
police social services. So there are two police officers working with one social work partner. They are in a standalone building
Mhm.
separate from the police station.
Okay.
And we have worked hand in hand with them now for, I'm really bad at this, 26
For a while.
years, for a long time.
There we go. Yeah.
And we are still, um, in some ways, ahead of much larger provinces than we are.
Mhm.
And may I add, Saskatoon, after all these years of us begging and pleading, still does not have a multidisciplinary children's advocacy.
Oh, they don't.
No, they
Oh,
don't.
so okay, so that's interesting to me because we, of course, nowadays we think about healthcare as a provincial because we have the Sask Health Authority, and so everything is provincial. But then obviously it's
All
not.
that means is we get phone calls from far up north asking
Mhm.
for advice, because if they phone
Okay.
Saskatoon, they are still sort of directed to us.
Right.
The plan for years has been that when they have the Wilmans and Children's Hospital, they will set up a program. Um, there was one of the pediatric residents who came through Regina who was wonderful and who spent a lot of time with us. And he has gone off to Toronto Sick Kids and is doing his subspecialty in child maltreatment.
Okay.
And then William Wheeler will be coming to Saskatoon and hopefully helping them set up a program. And we then will see how we can manage to support each other. We're offering, we have an educational fund after the first 10 years of doing this, where we paid for our own education. The
Okay.
health district then set up an education fund so that we could go to the major conferences in the States and Canada and stay up to date.
Ah, okay.
And so we are offering to use our education fund to help pediatricians and PA in Swift Current who are interested in sort of being the point person for child maltreatment work.
Okay.
So Dr. Juliet Soper, who's the area head for Regina, is a pediatrician on the child abuse team with us.
Mhm.
She is actively reaching out to pediatricians and wanting to help them get the education they need to do this, because the basic pediatric residency is including more and more child maltreatment information, but not to the detail that they need. In most provinces, this is a pediatric job. We're one of the
Okay.
few jobs with family physicians, and in fact a nurse practitioner as well, who is wonderful and a total ball of fire and energy.
Okay. So help me out with one thing. So doctors traditionally, of course, look at the physical, right? What's wrong with you? And we don't spend a lot of time on the okay, time out.
We look at the whole person, so the mental, emotional, and physical health of the person. Thank you.
But don't you think that has evolved? Right? Like when I go to my family doctor each year now, she does ask about my mental health. But 5 years ago, I had never been asked that question. Now, maybe she spotted that I needed some mental health support lately or something.
Well,
but that was a question I had never been asked before.
I do think that the actual education on managing the whole person has evolved. So good family physicians, and remember, I'm old, that sounded really arrogant. So I didn't mean good family physicians, i.e. me, but family physicians who have been doing this for a while. If your patients have a comfort level with you, then you we're comfortable saying, and how are things going at home, and how are things going at work, and having someone tell you or burst into tears, or you've been talking to me about this and that, but you know what? I don't know that there's a physical cause for all these symptoms. What's stressing you? What's bothering you? Heck, believe me, when I was trained, something as simple as, hey, what's your gender preference for a sexual partner was not something that was ever brought up. It was just something you sort of learned along the way. Please do not make the assumption that everyone's partner is the opposite gender from them.
Mm-hmm.
So I do think that the training that medical students get now is far and away ahead of what we were given as far as treating the whole person. A whole lot of us learned on the job, and it was probably our patients who beat us into shape.
Yes, exactly. And just, even from a society perspective, what was acceptable 30 years ago is not necessarily acceptable anymore. And what was okay to ask, or what is okay to ask now, wasn't okay to ask 30 years ago, right? And so had you asked a patient about sexual preference 30 years ago, like you may have been, in a little bit of trouble yourself as a family physician, where nowadays it's almost an assumed question.
Not in trouble, but I might have been lied to by the patient who might not have felt comfortable or might not have felt safe.
Okay.
And I
yes.
certainly hope I've got patients I'm into the next generation. I've got patients who started with me who, when they were teenagers, who have children, and now those children are having children. I told you I'm old. So it's a different thing. I now have patients saying, but you can't retire. And I'm going, really? Ever? Because I'm going to be senile someday. You will be sad when I'm a 75-year-old doddering.
Oh, goodness.
I always said, because of the ADD, when I segue into Alzheimer's, how would anyone be able to tell the difference? So there's that.
So Sharon, let's talk about breaking this cycle, though. So great, we're identifying the problem more often. I know we're not identifying it all of the time, or probably even often enough. But how do we break the cycle? What's missing for families?
Education and housing and employment.
Okay.
In housing and employment.
Yep.
Great conference I went to 2 years ago, and the stats are proven over and over and over again that you spend $1 in housing, $1 in education, and not that many years down the road, you are saving $10 or $12 in justice and $10 or $12 in health.
Wow. Yeah.
To just go back to the basics. Education, housing, employment.
Yeah.
That's what's going to make the difference. Finding a way to help people stay in school, to support them if their needs are somewhat different than the next person. Having a society that actually looks at every form of employment, as opposed to a more American style free enterprise at all cost, and let the strongest survive.
Mm-hmm.
That leads to an unhealthy society. For heaven's sakes, look south.
Yeah.
Unhealthy society. Okay.
No kidding. You don't have to look far right now.
No one is couch surfing.
Yeah.
And if a family breaks up, what are we doing to support the children? What are we doing to give safety and security to the children who are maybe couch surfing or passed from relative to relative, or who are aged out of the system?
Yeah.
16, 17, 18, here you are, you're on your own. You haven't finished high school. You have no employable skills. Hit the streets. Like, that is ridiculous.
Yeah.
And that nurse practitioner friend I told you about, who, by the way, is the little witch who got me into this by nominating me, she works of her own choice. She works with the group homes for homeless teenagers. She works child abuse. She works family practice. She's the one who absolutely should have been nominated, but I'm not that smart at keeping up with things. But it's people like her who are making a difference. Honest to heavens, if we don't have enough good homes, you know what? A good group home is better than no home.
A roof over your head. And it's funny that you list those three, because quite often, I think my kids have it pretty good, and they'll complain about things they don't have. And I think, like many parents, it's like, you got a roof over your head, you're going to school, and you got food on the table at least 3 times a day, if not 5 or 6. So, like, don't even complain to me, right? But
we all have to deal with our adult children. Oh,
exactly.
Mine are adult. And then, okay, can you please rephrase that with want instead of need? There are needs and there are wants.
Exactly.
And,
yeah.
I don't want to hear that you need this.
Exactly. We talk about that a lot.
Of course, I told her she needed to come and help me set this up.
Yes, exactly.
Mom is incompetent, honey. You got to come here before your appointment.
Well. Exactly. Sharon, we only have a couple of minutes left. So if there was something that you would like our audience to take away from our discussion today, what would that be? What is that one nugget?
Okay, the one nugget is that even if it's only handling the retroactive, the problem has already occurred. The duty to report extends to every person who has a suspicion or a concern. Even as a medical person, I don't do the investigation. I don't have to have certainty. A teacher doesn't have to have certainty. A neighbor doesn't have to have certainty. They don't have to have proof. They have to have concern. So a reasonable suspicion or a reasonable concern fulfills your duty to report.
Right. And how does someone report? Do I call 911? What do I do?
Well, let's not use the emergency line. The duty to report is to a peace officer or the Ministry of Social Services. So either of those are the appropriate person. So rural, it might be the RCMP or it might be their local social worker. There's a the child protection intake line. Government child protection intake line. And it's confidential so that if a family is approached saying someone has a concern, they are not told who it is. Because literally there are people saying, well, I was afraid to report because it's my neighbor and he's kind of violent, or I was afraid to report because it's a relative and I don't want them to know because it would mess things up in the family, etc.
Yeah.
So it's certainly easier for the teacher or someone who perhaps is removed from the family a little bit. But we all have that obligation.
Okay.
And we're often having to tell physicians that, you know what, somebody, a grandmother or mother or whoever brought you a child and said, I am concerned that, guess what? There's no transfer of duty. You don't get to tell the parent, okay, now you better phone. The doctor is now medical, legally, ethically obligated.
Exactly.
So it's basic family practice. You are taking care of the interests of your patient. And if it's not within your scope of expertise, you would refer to a specialist.
Okay.
Same thing.
Okay. Wonderful. Well, thank you. I so appreciate that. It's hard to believe that time has already passed because we are out of time for today. And so thank you, Sharon, for joining us to talk about something I know is way too prevalent in our society. We never even got to mention the YWCA of Regina Awards of Women of Distinction. There we go, as I trip on my tongue. And Sharon is a nominee. Now, of course, this year the awards have taken on a very new meaning. And I believe they're looking at a ceremony possibly in the fall. So I certainly wish you luck and hope to see you up on that stage that night.
Something else I'm dreading. Thank you for bringing me up.
Oh, you'll do awesome, Sharon.
Okay.
If you'd like to be a guest on the show, you can email me at barb@googlegirl.ca or reach out on Facebook and Instagram at abovethefoldca. And just a reminder, you can even submit questions in advance of our live show on our Facebook page. I'm your host, Barb McGrath, local business owner and Google Girl. Remember, you worked hard for your success. Don't keep it a secret. Bye for now.
Goodbye.